Welcome to the COPD Foundation podcast. We bring you insights from leading health professionals, inspiring stories from those living with lung conditions, practical advice, and the latest in lung health research. Be sure to subscribe, follow us on social media, and visit copdfoundation.org. Take action today, breathe better tomorrow. Just a quick note before we jump into our topic. This podcast series was created for educational purposes only and is not a substitute for formal medical advice. Talk to your healthcare provider if you have any questions.
Welcome to the COPD Foundation podcast. Today, we're going to discuss how people with long-term health issues can access more advanced treatments and how their care teams can help support them in this. This episode is going to be designed for people who feel stuck or frustrated or overwhelmed as they try to access different parts of healthcare. I'm Jonnie Korinko. I am a respiratory therapist and an educator here at the COPD Foundation. And joining me today is Amanda Atkinson. She's also an educator at the foundation and is a registered nurse with experience in patient access and patient care.
Hi, Jonnie. Thanks for having me on this broadcast with you. I am so excited to talk about this really important topic. And it's so important because often people that have trouble getting needed care end up, blaming themselves. And the system is difficult to navigate. And it's hard enough when you have a chronic condition and you're not feeling well as it is. But to have to jump through additional hoops does make things really difficult.
Absolutely. Thank you so much, Amanda, for sharing your expertise today. I want to start off with a real world example. I'm not going to name any names, but I want to share a case, something that many listeners are probably going to recognize and may sound a little familiar to them. So this is someone who has had COPD for many years. And even though they take their inhalers like their doctor prescribed, they're still having flare-ups. They're still having those lung attacks. And with that, they're continuing to have trouble breathing. Their doctor suggested a more advanced therapy and something that's a little bit more targeted to helping their specific issue. And that's where things got hard for them. From your perspective, Amanda, what usually happens next?
Yeah, Jonnie. Well, this is where many people really feel a sense of relief and they think, oh man, there's an option. And there is, which is really good. But then suddenly there becomes a lot of forms needed or phone calls, and it just feels like they're having more waiting. They're not seeing things move. And in this case, a lot of times what has happened is the prescription actually went to a specialty pharmacy, not just the regular local pharmacy, because of the type of medicine it is, or maybe the type of insurance that the patient has. And so insurance a lot of times has asked for documentation like symptom history, prior treatments, sometimes even appeal letters that the doctor's office would need to provide in order to get that medication covered.
Yeah, and for this person, they're just trying to get their medicine. So it can feel like rejection, right? Like when it's really just a process, they feel like they're being rejected, that I can't have my treatment. When in actuality, this is just kind of the way that we have to move through this system in order to help them get their care.
Exactly. And a lot of times the patients think the medication's actually been denied. And sometimes, through no fault of the pharmacy, that is kind of the way the information sometimes is relayed to the patients. Because sometimes there's an automated system and they just, people call and they just see, oh, this wasn't filled. But in reality, it wasn't denied. It was just pending more information, or maybe they needed something that's called a prior authorization. And that is a huge difference, but it doesn't feel that way when you're the one that's on the other end, when you're the one that's really needing this medication or this treatment and you're still waiting.
Absolutely. And when this happens, how can we help people kind of move this process along? How can we help them move forward?
Two words that I love, Jonnie: collaboration and communication. And so this is where the patient and their care team really can work together. The nurse and the doctor's office, they're gathering the needed information, the documentation that the insurance company's asking for, or they're completing the requested forms, needed by insurance. Maybe the RT is documenting how severe the symptoms are, and the provider is submitting an appeal. We also connect people with the financial assistance programs through specialty pharmacies, depending on what the needs are and what the insurance company is actually asking for. But it doesn't happen overnight always, which I know can be sometimes really frustrating, but it does happen. And so it's really important that when you're in the middle of this process, when you're navigating the process, that you don't lose hope, that you don't give up and get frustrated, but just know that your team is working for you in this process.
I think that's the most important part, Amanda. Like, we're all together, we're all part of a team, and progress in this isn't instant. It doesn't happen all of a sudden, unfortunately, like we would like it to. But those barriers that we face, that we come across, they're not the final step. We can work together to get through them.
We really can. And I think that patients need to know that we are there for them. And when they are feeling this, that they're not alone, they're not by themselves, that we really are behind them and trying to work to get these things, pushed through so that they can feel better.
So let's quickly compare some myths and facts, some common beliefs that don't always match what the actual reality is. So the first myth that I want to bring up is that if insurance denies it, I can't get the medication, treatment, whatever that might be. I don't qualify.
Right, Jonnie. We hear that a lot. And the reality is that an initial denial is actually sometimes just part of the process. It's not the end. Appeals exist. They exist for that reason. And many approvals happen after we submit more information. And it's not always a ton of information or very hard information to get. Sometimes people wonder, well, why do they need more information? Why wasn't that information submitted when the order was sent over the first place? And the reason for that is every insurance plan is different, just like every patient is different. And coverages vary. They can vary based on the diagnosis. They can vary based on what treatments, the other treatments that the patients are receiving or that they've tried before. Sometimes even allergies, right? They could, the insurance might say, oh, you need to try these 3 treatments first, but a patient's allergic and they don't know that we can't try those treatments, right? So we have to send over all that pertinent information. And so the doctor's office doesn't even always know what information is going to be required or requested because of all of those things. So of course they try to anticipate, we try to see what's, okay, we think they're going to need these things, so we're going to send them over at the beginning. But sometimes it's just a process. And sometimes we just have to go through that process.
Yeah. And that's where you mentioned earlier that, like, on the other end, you're the one waiting. And that can feel frustrating when you get this denial because not all of the information was submitted up front. But, unfortunately, even the same insurance might require different information based on different situations. So I think, as you mentioned, being proactive, working together with your team, gathering as much information as you can definitely helps speed up that process along. But just because there's an initial denial, and this has happened to me, doesn't mean that's the end. Absolutely not. There are ways that we can advocate. So another myth, if it's expensive, then it's not for me. Then I just can't access it. And this one hurts a little bit, right? This one kind of breaks my heart when I think about all the people who believe this and aren't getting access to different care options that would benefit them.
Right. Unfortunately, I actually hear this one a lot. Many patients believe that there are no other options. I even had a patient, before I became a nurse, I was a financial counselor at a pretty large clinic that we have here locally in town. And I had a patient tell me one time that they were going to have to choose, or they were worried that they were going to have to choose between groceries and their medication. And they knew that they needed their medication because if they didn't take it, then, they're getting sicker. They could end up being in the hospital, but they had to eat also. And I mean, it was such a heartbreaking place to be and to sit with that patient and be able to, talk those things out. But the good news is in many advanced therapies, there's some sort of financial assistance program that's offered. Sometimes it's through the pharmaceutical companies, sometimes there's other options. Specialty pharmacies actually often have teams or a person that works there that's dedicated to helping patients find that support. And sometimes even doctors' offices like I did. That was one of the things that I did, was actually look up different financial assistance programs and try to help patients get connected with ways that they could get medication either at a lower cost or maybe at no cost, depending on the situation. But there's also a lot of charitable organizations that are dedicated to providing copay relief or supplements for medication treatment. And so, it's really important to think outside the box in those kind of situations, right? And this is another place that communication, I love that word, is so very, very important. And we don't always think about it, right? We think, okay, we got to talk to our doctors when we're in an appointment, but like anything that's related to our healthcare, to our access to care, to symptoms, to things that are going on, communication is number one. And it is one thing that I want to say, and please everybody hear me, it's okay to ask for help. It's okay to ask for help. And if you have a need, talk to your pharmacist, talk to your doctor's office, reach out. Don't assume that cost equals impossibility, because there are things and there are places out there that are made, their mission is to support and help you to be able to get the care that you need.
Absolutely. And one thing that you kind of touched on that really stuck out to me is that, when we're at the doctor's office, a lot of times we have a very short period of time to talk about a lot of different things. And so we might have questions that come up afterwards, right? That we either didn't think of at the time or that we encounter later. There are a lot of different resources available other than just our doctor, other than just our healthcare provider, right? So in your case, you were a resource at the clinic, right? At the provider, which is absolutely amazing. But there are other, like you mentioned, specialty pharmacists. A lot of our pharmaceutical companies will have, because they want you to be able to access the care that you need. But also, there are some great charitable organizations, as you mentioned, that will help with, they have copay relief programs and even like free case management to help you find the best insurance coverage to be able to afford the treatments, whether it's pharmaceutical, whether it's, that pulmonary rehab that you can't quite get to, or another advanced therapy, whatever the case may be. There are options and there are people out there who are invested in helping to make sure that people can get their care.
But one other thing that I really heard while we were in, when I was doing the financial counseling was people getting their medicine, right? A lot of times when you don't feel good, you can't always get out of the house. You can't drive. Sometimes people don't have cars, things like that, to actually, maybe they go through the hoops, they get access to the medicine, but then they can't get it. Adult aging services, community organizations they can help you not only get copays paid and get access to medicine, but they can deliver medications to you, or some of the, the pharmacies and things like that have programs. So please, if you run up to a barrier of any kind, reach out and ask for help. There are places and people that will help you.
So the last myth that I want to kind of debunk, if you will, is that my provider, my doctor, or whoever I see will be able to tell me everything that I need to know. And we kind of touched on this. Providers are doing their best, right? Like they are doing all the good work, everything that they can do, but these visits are short.
Right. And one thing that I always would tell my patients, you are an important part of your own healthcare team. You are your best advocate. Your needs are important. Your concerns are important. And you have to, as a patient, or as a caregiver, right? Because I have children that have some health concerns. And so even today, I was on the phone with the doctor's office trying to advocate for them, right? So caregivers can advocate, patients can advocate. We are all part of the care team to get you the best care that you need. And so patients who ask questions, caregivers who ask questions, whether they're about the timeline, when a doctor prescribes a new medicine, hey, Are you guys seeing that? And maybe you ask the nurse or the office manager if you can't ask the doctor. Are there timelines that you generally see with this medicine? So you're knowing what to expect on the front end, right, of this, and asking those questions about timelines or appeals or any assistance, anything like that. So patients that are proactive in that communication often get further faster. And so advocacy really does matter, and you are your best advocate. So stand up and advocate for yourself in those situations.
I think a lasting message I want to take to make sure that we get across is you are in control of your care and use your resources. If you have a family member who can help you, if you have someone else who is observing something and they can make phone calls on your behalf, that is excellent. But if providers don't hear from you, they're going to think you're doing okay.
Right. And, I think that we often think, well, I don't want to bother them because they're busy, right? Patients come into the office, they see the waiting room full of other patients, or they understand that medical staff is busy. And we are busy, the offices are busy, but our whole job is you. Right. Our whole job is caring for you as the patient. And so asking questions is not a bother. You are not bothering the office by asking questions. We want you to ask questions because what it says to me as a clinician is that you care about your care. Right. And people that ask questions I know they're going to take their medication, or they're going to participate actively in their healthcare so that they feel better. And so you are not a bother. And so if you have questions, ask. If your caregivers, some people feel like, well, I don't know what to say. I don't want to ask questions. But most people have somebody in their life that's not afraid to ask those questions. And like you said, Jonnie, take advantage of those that are in your life, that are in your inner circle, that can help advocate for you if you need help with that.
So let's leave our listeners today with a little bit of practical advice that they can take from this. If someone's listening right now and they're thinking, you know what, this sounds really familiar. What can I do? What advice would you give them? What would you say to them?
Yeah, first, just basically what we've just been saying, use your care team. We're here for you. We're here to improve your quality of life in any way that we can. And so, again, respiratory therapists, nurses, pharmacists, but don't just think, again, inside that box, think outside the box. Are there community places that you can go to? Is there a church? If you're connected with a faith community, if you're connected with other community groups, a lot of times people that are around you know about other resources that you may not know about, right? So use your care team. We're all part of your support system, and we're here for you. And the second thing is, don't be afraid to ask direct questions. If you are not sure about something, ask. Is this medication coming from a specialty pharmacy? What's the next step? If the medication's delayed or denied, or there any information you might need from me in order to get this medication covered, is there financial support available? You know your circumstances, you know what's going on, your obligations elsewhere. And again, we all have life. We all have things that happen. And so the doctors and the nurses and the pharmacists, they understand the things that are going on because they may have those same things going on themselves. And so it's okay to say, I need help. It's okay to reach out and say, I need help. And also trust the process. So sometimes we don't understand that there is a process, but trust your care team, trust yourself, and trust the process.
I would add to track your symptoms. Write them down. If you're having a hard time with breathing or walking further than you used to, or, playing with your kids or grandkids or whatever the case is, write that down, track that information and share it with your provider. That information is going to be able to help them, support those approvals, and more than people realize that it really does.
Actually, to your point, Jonnie, one of my children gets migraines very badly, and there was some medication that was from a specialty pharmacy. It was a biologic medication that we were trying to get, navigate this process. So we have been here. Jonnie's been here. I've been here, so we're trying to navigate the process of getting this approved. And one of the things that was of utmost importance in order to get that medication approved was to show that there had been a change and we had to write it down. She actually had to get an app on her phone and like keep track of how many headache days she had and how severe it was and all of that sort of thing, because we had to show that the medication that she was taking currently was no longer working to help her to be better. And so through that documentation and through tracking the symptoms, we were able to get the things that she needed. So super, super important. And one other thing, make sure to follow up. Call, check in, ask questions. Like we said before, it's not being difficult. It is not bothering somebody. It's being engaged and it's advocating for yourself. And that's very, very important.
Okay, Amanda, and we've talked a lot in this episode about the processes and trying to make it work and what to do if there are barriers to try to get a success. But sometimes we do get the denial. So what are your tips for advice, or what recommendation do you have for people who do ultimately receive a denial for a treatment that they were really hoping would help their symptoms?
Yeah, I think first and foremost, Jonnie, is don't lose hope and don't give up. Sometimes we do navigate the process. Sometimes we do everything that we can and it is still denied, but it's not the end and hope is not lost. A lot of times there's, communication again is really, really important in this instance. Checking with your doctor. Is there anything else that I can take that may be similar to this medicine or may do the same thing, and stopping the process and not just saying, oh, okay, well, I didn't get this. So, that's it. There's no other options. It's communicating with your health team, but then also not giving up that and assuming that it's never going to work, right? Because there's been situations where we've maybe had a patient that had a denial for something, and then 6 months later, when symptoms have changed even further or insurance has changed a little bit, that something we go through the process again and it actually gets approved. So one, you didn't do anything wrong. You did everything that you could do, and not to lose hope. And also just remembering that the feelings you're feeling, if you have experienced a denial, the feelings you're feeling are normal. It's okay to process through those feelings. It's okay to talk about those feelings, but don't lose hope and don't give up. Just keep pushing forward.
I would also add to not wait. Call your provider, start that process as soon as you know that you've had a denial, because there might be other options that might be a very good fit or a really good option for you. And that happened to me. I had a change in insurance, and where I was previously on one medication through specialty pharmacy that required prior authorization, and a long process, as we've already outlined. Now all of a sudden it's not covered. Now all of a sudden I have a denial. Immediately, I'm on the phone, I'm messaging through our portal, and they didn't necessarily know that I had gotten a denial at that point yet. So had I not immediately gotten on the phone and started messaging, I wouldn't be on the coverage that I am today, the treatment that I am today, which honestly works much better. I have much better symptom control and is covered by specialty pharmacy and by my insurance. So, overall, being proactive to advocate for your care, I think it would be my message here.
Yeah. Yeah. And so what you're saying, Jonnie, if I'm hearing you correctly, is that the original medication you were on was no longer covered. But because you reached out, because you asked, there was a different medication that the doctors were able to get you on that was covered. And actually now you're better. You're better off than you were with that first medicine. And so what started out as something that might have been a disappointment or a barrier or something that was negative actually turned into something better for you and better for your quality of life.
Absolutely. And, the initial response is, upset, frustration, anxiety. Am I going to have something that's going to resolve my symptoms and help me feel better? Fortunately, the answer was yes. For me, the answer was yes. Amanda, do you have any final thoughts for our listeners today?
Yeah, if Jonnie and I could leave you with anything, I think the main thing is barriers do not mean that you're out of options. Just because you come up against a delay doesn't mean that you're out of options. It doesn't mean that it's a no. It means the system needs navigating and you don't have to do it alone. So no, lean on your care team and just, again, trust the process.
Absolutely. Problems accessing care are unfortunately common, but they don't define your worth. They don't define the effort you're putting in or really even your eligibility for care. Thank you, everyone who joined us today for listening to the COPD Foundation podcast. If you found this episode helpful, please consider sharing it with a friend who might be able to use it. Have a great rest of your day.
Thank you for tuning into the COPD Foundation podcast. And remember, whether you're managing a chronic lung condition, providing support to those who are, or just want to learn more about lung health, the COPD Foundation is here to support you. Be sure to subscribe to this podcast and follow us on social media. Take action today, breathe better tomorrow.